Okay, so just like we discussed the other day, we are seeing disease in the pancreas, lymph nodes around the pancreas, liver, and some small lesions in the lung also.
Oh.
Okay, so these are 4 areas of disease that we are seeing on this.
Same as it is. Yeah, sure.
So lung we haven't seen on the CT scan, so we are seeing doubtful lesions in the lung on the CT scan. So in terms of the treatment and the outcomes, it's very similar to what we discussed. We are looking at a disease that is not curable. You see this marker is also quite elevated, so it has to be less than 37, it is 2490. So by treating, we can temporarily control this disease. We cannot completely cure the disease. And chemotherapy remains the only option in this disease. For other cancers, there is immunotherapy, there is targeted therapy, all those things. But unfortunately, in pancreatic cancer, we haven't found much usefulness to all these things. We can do some additional testing on the biopsy to check whether she has any opportunity for something like that. But the probability that you will find something is very, very small, it's less than 5%. So the majority will go on chemo, and that is, as we discussed the other day, weekly treatments for 3 weeks, and then 1 week is a break. Like that, we will do for 2 months. The responses, which means tumor shrinkages, happen in roughly around 25% to 30% of all patients. The other 70% of patients may either have stability or even worsening disease while we are still treating. Even patients who have a response tend to have a response that sustains for 4 months, 6 months on an average, and then it increases again. When it increases, some patients are fit for the next line of treatment. Some patients are not fit for the next line of treatment. So if she's fit, next line of treatment. If she's unfit, we may say, don't go ahead with another line of treatment, because the benefits of a second line treatment may be much more than the, maybe much lesser than the side effects that come along with the treatment in the second line. There are many patients who will decide to just take symptomatic treatment rather than any anti-cancer treatment. The average survival for somebody with stage 4 pancreatic cancer is around a year. That's the average. Depending upon how much treatment one is able to take, depending upon the response, that survival can vary between 6 months to 2.5 years also rarely. This is roughly the status based on what we are seeing on this value and CT scan. This is what it is. So one option is to treat, obviously. Now there are some caregivers and families who will think, along with patients, who will think that the amount of difficulty that one has to go through for this benefit is quite a bit in terms of side effects, which can be bad in some patients. So not aggressively treating the disease is also an option.
Okay.
That means we just treat symptomatically. Tomorrow there will be pain, you treat for the pain. Tomorrow there will be jaundice, you treat the jaundice. There may be diarrhea, you treat the diarrhea. So like this, you only treat the symptoms. We
You're
don't
not treating the
problem, the disease, correct. So which means we just give her palliative care.
palliative care. Yeah.
That is also an option, because we are seeing a disease wherein cure is not feasible. Survivals are very limited, and the treatment comes with some side. So that is certainly an option that one should actively think about in patients who have this kind of a picture. That is what it is. So we are done as far as tests are concerned. Of course, we must have submitted the block for the review. That report will come. But pending that, I think we are done with all the necessary tests. Now you should go back probably and take a decision on how you want to go about making the next steps.
You have any question?
There is one question only. If as per your second opinion, which you have told that if she got cough, okay, we'll treat for the cough only. If she gets pain, we have to give
Painkiller.
her painkiller. And in that case, we have to give glucose and like these things. And
So so the thing is like this.
Yeah.
So let us say we are treating versus we are not treating. When we treat, if there is response, we are going to postpone all these problems. So instead of these problems happening in 6 months, it may happen in 10 months. But ultimately, everybody will go through this problem. Whenever somebody is not able to eat, saline, glucose, whatever it is. Whenever the pain is not controlled with the existing pain medications, more pain medication. So that's how it.
And first, treating at home or in hospital, these treatments.
So palliative care treatments should be as much as possible done at home.
None.
Done at home.
So
Only
you
if-
give us, you suggest us.
You
the-
So we will put you through to the palliative care group.
Okay.
So they will take over the symptom control and care and then help you at home.
Okay.
So they will do a video call or
Oh.
things like that.
Hmm.
On and off, we can come to you.
So I usually stop seeing if we have transferred, we are not doing any anti-cancer treatment and we have transferred the care to the palliative care physicians.
I see.
I routinely don't see unless there is some specific reason that they want me to see.
I see.
So that is why.
Okay, if not, if we take appointment and that's for 10 minutes and discuss or 5 minutes, so that
You can come, there is nothing wrong in coming.
I see. So there are the two options. First option, as you have
Treatment
given
is one
before,
option.
you told. The second one
option
is.
is no treatment, only palliative care.
Then when we start treatment, okay, which kind of medicines you will give? Suggest. It
I'm
is
not giving any
No,
medication.
For
Oh, no, he means like, is it like, if we start the chemo?
chemo.
We should try to keep it gentle.
Yeah.
That's I got it.
So there is no chance of radiation?
No, radiation is done only if the problem is in one place.
Oh.
So now we've got 2-3 places. So
Oh,
radiation is not
okay.
enough because we can't radiate.
There are. These are the points for radiation.
Uh,
Chemotherapy will be
chemotherapy helps
That's
all over the place,
All over.
right?
Yeah.
And radiotherapy is one place.
one place.
So now we have got 4-5 lesions in the
4-5.
liver, one in the pancreas, some lymph nodes, then
And
some small dots in the lung. So we cannot go about radiating every single one.
Mm.
Let's say tomorrow if the pancreatic lesion causes a lot of pain, then we may decide to do radiation only to that area
Mm.
to give her pain relief.
Okay.
Other areas remain the same,
Mm.
like that.
okay, if we want to start chemo, we have to come to you.
Correct. If you decide to go ahead, any day, whichever day you decide, morning 7:30 a.m. after breakfast.
After break.
After breakfast.
Morning.
We have to
correct.
bring her.
You just bring her, you will tell the sister here that you have come for your chemo.
And we can call first to you.
You
or
don't have to call anybody.
Any time we have to come
Yes.
and
7:30.
7:30, Dr. Senthil says this is that. Fine.
You come for chemotherapy.
Okay.
Correct.
We just call one day before and say
You
we are
don't
coming.
have to call.
Oh, nothing.
Nothing.
All chemotherapy patients are here by
if
7:30.
If we are
If you
decided
decide not to,
tomorrow,
you will
no,
just
if we decided for tomorrow,
You
we
will
have
come
to
tomorrow
come
morning.
7:30 and then start.
Eat food and
You
come and
come
start.
and
Okay.
start. So you will see them.
yes, I will see her. I have to see her height and weight. Tell her a few things about the chemo, not necessarily about the disease,
Fine.
so that she understands what's going to happen. Everything should not be a surprise for her.
Mm.
So we will tell her it can cause hair loss, it can cause this, that, and all those things. And then we will admit her for the treatment. Evening she will go. That's what we want.
Thank you.
Oh.
Just let me write that.
You have any question? What?
So if we are starting the palliative care,
You will just come, bring her one day.
oh, we have to again bring her one day.
Yes, because
and
they have
then-
to see,
Oh.
they have to see her
Uh-huh.
and then check what symptoms are there to start. Then
Mhm.
after that, you don't have to bring her.
Okay. So they take care, and whatever hour of the night or day,
Yes, they
We
will
call
keep in
them,
touch, then
yeah.
you will, if necessary, come to the emergency,
Mhm.
you know, like that. So you will just come and then tell the sister that you want to get referred to palliative care.
Mhm.
So I will write a referral to palliative care so that they
Okay.
will see her after that.
One more thing, you have seen her. My personal question it is, what is your opinion, little bit?
So I think as long as you are willing to take those few side effects,
Yeah.
it's worth giving it a try. And then if either it doesn't work or if she is unable to take the treatment, you obviously stop it. There's nothing like if you start, you have to continue. Let's say you do the first week,
For this reason.
you do the first week,
I want to.
you're not
understand.
happy, you stop it.
Okay.
There's
So
nothing
that
like you
is
have to.
nothing.
No, that's
nothing
not.
will happen for them.
No.
Okay.
Stopping in between is not
It's not.
detrimental from a side effect, or it's not like suddenly the disease will start increasing. There is nothing
Okay,
like that.
okay.
So
And
patients
when-
stop when they don't like to continue anymore.
Continue. Okay. And how about her diet plan? Okay.
So when there is no restriction on diet, when you're coming, we will ask the dietitian to see her. They will advise.
Not before that, like now,
There's
right
nothing.
now, what we have to give her or anything, nothing.
Absolutely nothing. Whatever she is able to take, she can take.
Okay.
No restriction.
No restrictions on that.
So thank you, doctor.
So now, okay, one more thing. Emotionally, how we have to
Treat her.
treat her.
There is no one formula for this.
I know, that's it. So
So
like,
it depends
now
upon what
after
kind
going
of-
from here, if she asks us, what did the doctor say?
So you will tell her that we are going to get on with some treatment,
Mhm.
and then our hope is that with the treatment things will get better, your pain will come down, and so on and so forth. The treatment has got X, Y, Z side effect.
Mhm.
So we'll start and then take it from there.
Okay, that's it.
Right.
Because this is
Because
like
this is
really
the
an
thing, really, we have this word so that, you know, it will be good for her.
Okay, you just tell her the.
scenario.
Generally don't touch upon anything in specific.
Mm-hmm.
We just tell her that we're going to do some treatment. This is how it's done. These are the problems. 2 months we'll do scan. If you have problem in between, we always stop. You know, some general things like that.
So we can say we are going to start with a little chemo, and if you are able to take it, we'll
Then
go
we'll
further
go
from
further
there.
from there. Otherwise, we can stop also.
So it is your decision, we can say. Okay, because this is such an emotional thing, so it's
That we-
hard for a family member to talk to her about all this, you know. So,
Because the
You
family
can-
members are very shocked, you know, because it's
Naturally.
something.
because it just
Out of the blue.
elevated out of the blue, and it elevated so fast and it spread so fast. So it is like,
Everyone likes her.
Yeah.
Most important thing is that.
so.
From
this is-
child to, you know,
Yeah.
big people also.
Yeah.
Oh, what
The
happened?
whole world, whole world.
It's like
Everybody.
everybody is like so emotionally disturbed. And
So let's pray that she gets better.
Okay.
Yeah.
Okay,
Thank you.
doctor.
Thank you, doctor.
So
Yeah.
this is for us, right?
Yes, that's yes.
Okay, thank you.
Thank you.
So bye.
喂，这这这，杨是讲哪个？